right. Good morning, everybody, and thank you so much for joining us today. I'm so excited to introduce Dr. Andrea Singh, who will be presenting on Park Nicollet Pediatrics today. Before I hand it off to Dr. Singh, I just wanted to share a little bit about her. Dr. Andrea Singh is the chairperson of the Department of Pediatrics at HealthPartners and Park Nicollet, as well as co-chair of the HealthPartners Children's Health Council. In addition, Dr. Singh has been appointed co-chair of the Governor's Children's Cabinet Advisory Council for the state of Minnesota. She also has the privilege of serving on the board of directors for local nonprofits, including Think Small, the Minnesota chapter of the American Academy of Pediatrics, and the Park Nicollet Foundation. And so without further ado, Dr. Singh, thank you so much for being here today.
Absolutely. My pleasure, Abby. And I appreciate everybody joining us today. I am going to share my screen here in a second and we will get started. Let's see. As it kind of pulls up, I just wanted to let everybody know that I don't have like any special disclosures or anything. I am very privileged to be on the Park Nicollet Foundation board. And we'll share with you a little bit of how the foundation also interacts with our Park Nicollet and HealthPartners pediatric departments. So let's get started here. So as far as the agenda goes, we're going to talk a little bit about the HealthPartners Park Nicollet Pediatrics Department. Who are we? What makes a pediatrician? What training goes into actually being assigned the role of a pediatrician? We'll talk a little bit about what we do as clinicians in the medical field to support children and their families, because it's always about the family dynamic when it comes to pediatrics. And then we'll also talk about what you as individuals can do to support the children in your lives, because we are living in very divisive times. And I think the more that we can do to support the next generation of leaders and those we love the most in our world, the better off they will be and the stronger they will be moving into their futures. All right. So starting off, like, who are we? And what is pediatrics? The American Academy of Pediatrics actually came out with an official definition of pediatrics in 2015, and they put out a policy statement really talking about what defines a pediatrician. And really, it's probably self-explanatory for a lot of people. It's a specialty of medical science that is concerned with the physical, mental, and social health of children from birth to young adulthood. And pediatric care encompasses a broad spectrum of health and services that include preventative health, but also going all the way through to acute and chronic disease. So, I think sometimes people wonder, like, should I take my child to a pediatrician versus another kind of doctor? And really understanding that pediatricians have, multiple years of training, really focusing on specifically the care for children in all aspects of their lives, as opposed to other types of medicine like family medicine or med peds, where the training is also extensive, but includes adult and pediatric training and maybe less time specifically on pediatrics. So in our organization, in the HealthPartners Park Nicollet organization, I am privileged to have a department that is full of amazing, amazing clinicians. And we have approximately 145 individuals in our department, so a very large group of medical providers providing care for children. Within that list of 145 clinicians, I have both medical doctors and nurse practitioners that serve kids that we care for. The MDs in our group have completed their full 4 years of medical school, and in addition to 4 years of medical school, declared at some point in their third or fourth year that they were interested in pursuing a career that specifically focused on kids. And so they then went into 3 years of residency training, that first year being called your intern year, where they specifically spent time learning all about children, whether it comes from, spending time in newborn nurseries and in intensive care units for neonates, but all the way up to the other end of the spectrum and adolescent health, behavioral health and mental health for kids, and everything in between. And then after residency, then clinicians are considered attending physicians and they get employment at a respective clinic or hospital. In addition, I have a fair number of nurse practitioners in the Department of Pediatrics, and the pediatric nurse practitioners that we employ have all done a little bit of extra training in pediatrics, have designated that pediatrics is where they want to spend the crux of their career, and so are also very astutely aware of all of the issues related to kids and excellent practitioners. We typically in the HealthPartners Park Nicollet organization see babies from the newborn stage, first hours of life often, to up to about 19 years of age. There's always a question about where is that appropriate transition time. If you have a pediatrician that you love, it sometimes is a little hard to break that relationship and say, okay, now lots of things are changing in your life as you turn 18 or 19. We're also going to transition you to a new medical clinician. However, I think 18 or 19 are the appropriate age to make that switch, as a lot of things in life are changing at that point in time. And some of the medical issues start to be more adult focused and probably are best served by somebody that is in family medicine or med peds or internal medicine that have adult training as well. But it varies. A patient that might have some developmental delay or some chronic medical issues that are very much related to childhood may stay with their pediatrician for a little bit longer, and that is appropriate. And then I already mentioned there are separate med peds departments and family medicine departments in the organization, and you'll see that in any healthcare organization that offers what we call primary care. And so the difference really is about the amount of training that everybody has in the world of pediatrics, with pediatricians, like I said, having 3 full years of training specifically dedicated to kids. So HealthPartners Park Nicollet Peds. I've already mentioned that we have approximately 140 clinicians on the team, 145, and we have clinic-based teams and hospital-based teams, and then actually a small urgent care-based team as well. So the clinic-based teams that we have comprise the majority of our department. And we are, in our organization, one of the largest, if not the largest, provider of preventative healthcare services for kids in the Twin Cities metro area. And I think, and our footprint, and we'll talk about our geographic footprint in a few slides, but covers all of the Twin Cities metro area, the 7-county metro area, but extends on the west side all the way out to Hutchinson, and on the east side of our geography all the way into western Wisconsin. And in a given year, we see approximately 200,000 well child and preventative visits. That's a lot of opportunity in my mind, a lot of opportunity to positively influence the lives of children and families. And we are very dedicated to providing evidence-based medicine using the American Academy of Pediatrics guidelines to allow us to do so in a really systematic and consistent manner, but also staying on top of new recommendations, guidance, etc. And so our clinic-based teams are amazing. And really, we are at the forefront of providing preventative care for kids in Minnesota and Wisconsin. We do have some hospital-based teams. We actually are present at deliveries and newborn nurseries in 8 hospitals across our geography. Again, extending all the way from western Wisconsin to Hutchinson. The 3 flagship hospitals really in the HealthPartners Park Nicollet system are Regions Hospital, Methodist Hospital, and then Lakeview Hospital in Stillwater. And amongst the 8 different hospitals that we serve and that we have our obstetric team delivering babies at, we are present for approximately 10,000 births in a given year. So again, lots of opportunity for presence, influence, and taking care of families at one of the most exciting times in their lives, but also potentially a very stressful time. And then I just wanted to call out that we do have a small peds urgent care presence as well. In our Maple Grove clinic location, we do have 3 dedicated pediatric trained clinicians that provide specific pediatric urgent care services. At all of our urgent cares across the system, we are able to care for kids, but that particular location in Maple Grove has dedicated pediatric trained folks that are there that serve the population of need. And then within the Health Partners Park Nicollet system, I'm not going to talk specifically about them today, but it is important to call out that we have many subspecialists that are specifically trained in pediatrics. A couple examples of groups that we have under our organizational umbrella include a really robust pediatric endocrine department, as well as peds allergy and asthma, peds dermatology, our Melrose Eating Disorder Center, which I know you've heard about in a previous coffee and chat. And there are many others as well, but important to call out that we do have some of those services. I think sometimes it gets a little bit lost in the grand shuffle because we are a very large organization, a multi-specialty organization that has many arms and tentacles and a lot of different aspects of healthcare, that we have such strong pediatric services within our system. But we do, really important to call out. So here's a quick map of our pediatric footprint, and I've already mentioned this, so I'm not going to spend much time, but we are in, I think it's 32 clinics across this geography. So some of our locations only have 1 or 2 pediatricians, some have pretty large, 11 or 12 member groups. And so really fun, and I am privileged to be able to lead the department across the system. So I thought this slide was interesting. This slide actually came from our strategy and growth department, and was a look in December of 2024 at the percent of pediatric primary care patients that we had and what it was compared to the population. And so no need to dive down deep into these numbers, but really what you see is that across our geographic footprint, in many places, we are seeing 1 out of 4 kids that live in that area as our patients, and they're identifying Health Partners or Park Nicollet as their primary place, their medical home for seeking pediatric care. Some places the numbers may be a little lower. A lot of that just depends on what other options for healthcare people have. Some places will be higher, as there may be not as many options. But I think it's interesting because, again, tells me as a leader of this department what great opportunity we have to influence, and also what great responsibility we have. I mean, I don't want to sound like Peter Parker, but we do have a responsibility when we are seeing all of these children to make sure that we are meeting the needs of families and really giving them the best care possible and the best experience possible, frankly. All right, so let's talk a little bit about what do we do in pediatrics. And many of you that are here on the call today probably have some personal experience. If you did not see a pediatrician yourself, you may have a child or a family member or a loved one that you have gone to a pediatric visit with. And so some of this may seem like a no-brainer, but I will tell you, I still get questions about why is it important for kids to have regular care, especially maybe for a child that doesn't have any chronic medical conditions. Is there value in coming in every year? And we do recommend, for kids 3 and above, we recommend annual visits. Under 3, the cadence is actually a lot more frequent than that. And some of you, of course, are familiar with that, having your own kids, but there is value, and that's different than perhaps when I was growing up, where it wasn't always super important or emphasized that we should have annual visits. But here is just a smattering of the many things that we do in preventative visits. And y'all can read the slide for yourselves. But when you see your pediatrician for a well child visit, or your family medicine doctor, or your med peds clinician, you probably will cover many of these things. And we adjust our messaging based on the age of the child. So when I see a 3-year-old and their parent, I'm talking to that child as well as that parent about all of these things. But my conversation, for example, about sleep is going to include talking about nap time and talking about how do we get bedtime routines in place and how do we like disconnect screens from bedtime and things like that. Whereas my conversation with a teenager is going to be about also disconnecting screens from bedtime, but like what time are you going to bed and what time does your sports practice end so that you can get to sleep, and what time do you need to get up, and why is sleep important, for your overall health. And so tailoring those conversations to the stage in which the patient is at, really, really important. I will say I've been in practice now for a little over 20 years. And through my time as a pediatrician, these conversations have evolved significantly in terms of what is at the heart of the conversation. The topics haven't really changed. We've always, and I've always talked about all of these things with my patients when they come in for their preventative exams. But how I talk about things with them and what we talk about has changed. And I think that's a really important piece of pediatrics. Kids are smart and they live in a different world than they did even 5 years ago, pre-COVID, or, even in the last 2 years. I think a lot of things and the way that children and families approach the world has changed. And so pediatricians regularly adapt our conversations to that. I think one of the most important things about pediatric preventative visits is actually not called out on this slide, and that is helping children and parents advocate for themselves. And so in a visit that I have with, say, a parent of a newborn, we're having a lot of conversations about what's normal, what's not normal, what do you need to freak out about, what you don't need to freak out about, and how do you manage those feelings as a new parent, in understanding that sometimes as a parent, you're going to feel a little bit helpless because you don't know what is right or wrong or what is normal or not. But as a pediatrician, I am your partner in that journey. And we're going to walk through that journey of your child's life together. And hopefully I can help you understand more about norms and expectations so that you can help your child thrive in amazing and incredible ways that you've never imagined. But we're also going to be there for the bumps down the road when things are not going exactly as you anticipated. And having that resource and that trusted resource that you can go to say, whoa, what is happening? Or my child is ill and I'm scared for them, but for myself and everything around there is really important. Again, as time evolves, as kids have that relationship, that longitudinal relationship with their pediatrician, we're spending time talking with not only parents about how to advocate for their child, but about children and how to advocate for themselves. So I often will get asked the question about why did I go into pediatrics, or how did I know that pediatrics was the right field for me? And to be honest, I think I was drawn to pediatrics because of how important a role teaching is in pediatrics. Both of my parents at one point in their careers were teachers. And I think that sense of like how important it is to teach kids about themselves and about their own bodies was just instilled in me like forever. And so as I kind of explored my career options, pediatrics just meshed everything that I felt was really important, whether it was, recognizing the psychological needs of individuals, the biologic needs of individuals as they change, the communication that's important to advocate for yourself, and the opportunity to help parents and kids build their skills. So, obviously, I think that peds is, just the most fun job to have and a great area of medicine. But I also realize I have a responsibility as a clinician that sees patients to convey that to my patients and families so that kids want to come in for checkups, that they're not afraid of stepping through the scary doctor door, that they're not afraid when I look in their ears, or we talk about the potential need for vaccinations. They're on board with why that is important for their health. And they understand that it's a step in protecting them and helping them. And they also understand that there is, somebody in their life that is not their parent, that is there to advocate for them and their well-being. So really important pieces to the preventative visit. And so a lot of it is role modeling. When I see older kids, it's helping them learn the skills that they need to have to be functional adults and to come to clinic visits without their parents when they're old enough and they have graduated from high school, and being able to ask the questions that they need to help themselves at that point in time. And I think that's a really big piece of adolescent medicine. We also, of course, see a lot of kids for non-preventative visits. So we call those acute visits, but it really could also be chronic care management. And again, I'm not going to read to you the things that are listed here, but it's just a smattering. Like, we see kids for everything. You name it, and I have probably had a patient on my schedule at some point in time over the last 20 years with the complaint listed of X, Y, or Z. And so you, as a pediatrician, as any clinician, frankly, you have to be ready for anything, because parents are coming to you or patients are coming to you because they're worried about something. And you, as a clinician, have to help them manage those worries and figure out if next steps need to be taken, reassurance needs to be taken, or somewhere in between. And really, really important, So this whole spectrum of what we do in acute visits, I will say over the last 10 to 15 years has skewed a little bit more to helping with mental health issues, because that is becoming a more and more pressing issue for the children that we live with. And I'm appreciative of the fact that I think kids are not afraid of stigma related to saying, I need help with my mental health, or I'm struggling. And I think this generation of children is in a lot better place than, say, when I was a kid, where people might have worried about coming to their doctor with some of those issues. Not to say that there still isn't stigma attached to mental health. One of the HealthPartners system initiatives that we have is our Make It Okay program, which has helped reduce mental health stigma. And we have had success with helping there, but there are still barriers. And we want to create that safe place where kids can come and feel safe to talk about anything that's bothering them. Whether it is difficulty breathing when they, do the mile run at school, or a rash, or mental health. All right. All right, so that's a little bit about our department and what we do on a daily basis. And obviously, there's a lot more. I know people sometimes get a lot of their ideas about what happens in the medical world from TV shows, or their own experience. So, right, you either have your own experience or you have Grey's Anatomy, and that shapes, your perception of what happens in the medical field. But the truth is, it's probably somewhere in between, though, both of those worlds, and sometimes depends on the setting in which you're practicing medicine in. But I wanted to give you guys a little bit of a sense of who we are as a department here at Health Partners and Park Nicollet, to help build context about why it's important for you to share that with those in your life that may have kids, and to underscore that pediatricians really do have the well-being of the children and families in front of them top of mind. That is why we chose this field, is because my team is deeply, deeply committed to improving kids' lives. And that is why we chose this field in particular. So, I've talked about what we do to support the children in your lives, but the truth is, for the vast majority of kids, they're maybe seeing us once a year. If they've had some acute visits thrown in there, maybe 3 or 4 times a year. But, and frankly, as parents, most of us are hoping that our kid doesn't need to go into the doctor beyond the one time a year. And so, probably a bigger question that a lot of us face is when our children are not with the clinician, when they are not in a medical setting, when we are in our day-to-day 365, 24/7 lives, what can we do? It feels like our kids are going through a lot, and that the world that they are growing up in is different than the world that many of us have grown up in. And I would say that is 100% true. The truth is, the world that we grew up in was different than the world our parents grew up in. And so that is not something new. What is new, I think, for the loved ones that have children in their lives is how do we approach some of the things that are happening? And studies show that children that have one trusted adult in their lives are just better off. And so, that one trusted adult does not necessarily have to be a parent. Unfortunately, kids don't always have available parents. You as an adult in the community can be a trusted adult for someone, whether you're a teacher, a physician, a friend or caregiver, a grandparent, a cousin, babysit, it doesn't matter. Who that individual is. It's more about how approachable you are. Are you trusted by that child? Can they come to you when there are issues? And how do you handle those issues? So really important to call out. How do you become a trusted adult, though? Like, sometimes there is a natural relationship that is built, and sometimes as adults, we feel awkward in conversations, or kids that, that are reaching out for help or express some sort of need. I would say first and foremost, what we can all do is listen. Sometimes, and we know this as adults, having somebody listen is more therapeutic than any advice they could potentially give. And it's not only about hearing, it's about listening and being an active listener. So giving a child eye contact, responding to what they're saying, reflecting their feelings back at them. That must have been really hard. Not trying to necessarily solve their problem or inject your own experience into what they might be going through, but acknowledging their reality and figuring out what they need. Sometimes it may just be a good listener, but sometimes it may be more than that, and they're reaching out because they need an adult to help guide them to next steps. Making sure they're safe is an important one, and there's nothing wrong with asking the question. If something in your gut tells you that the child in front of you is not feeling safe, you are not going to create new feelings of not being safe by asking the question. Are you okay? Are you safe? Do you need something from me? call a spade a spade. Kids are great that way. They want you to oftentimes call things out. And we can't be afraid of shying away from, of addressing things, because things will go unsaid that really need to be addressed. Another thing we can do for our kids and our families is follow through with routine well child care. Give them the opportunity to be in a safe space in a medical office so that we can do things like assess their growth and development, get them caught up on any necessary vaccines, help them do the mental health screenings that we offer, to talk through how are things going at school, to talk about healthy eating and sleep. All really important things. And the other things on here, I think I've already talked about. I think simply being present, showing that you care, coming off of your screen to engage with kids is great modeling behavior. We are living in a world where many of us are a little too dependent on our phones and our screens, and oftentimes that may be taking the place of one-on-one interpersonal communication. And you know what? Our kids, whether they appreciate it or not, need us to talk to them and look them in the eye. And, I would be lying to you if I said I didn't have multiple text exchanges on any given day with my family members that might even be within the house with me. And I think that that's the norm in most households. However, we also have to take the time to engage on a one-on-one basis because all of our communication can't be that way. All right. Let's see. So I wanted to call out as we're kind of wrapping up a little bit of, well, before I move to this slide, I just wanted to acknowledge that these last couple of weeks have been particularly challenging for children and parents and people that care for kids in our community with the Annunciation shooting. And some kids may be struggling to feel safe in environments where they have previously felt safe. I think I was in another meeting this morning, and someone mentioned, one of our behavioral health leaders mentioned that, back in the olden days, the thing that kids were most worried about was a fire drill or like a pop quiz. And now they're worried about, getting shot at school. I think, again, when things happen, pay attention in the news, in the media, in schools, pay attention to how your kids are acting and how they're feeling. Don't be afraid to talk about it and ask the question, like, how are you feeling about this? Did you want to talk about it? Are you worried? And be open to those conversations, because you will learn a lot simply by asking questions. I'm amazed on a daily basis by the things that I learn about kids simply because I asked. And again, you won't always have answers for them, but asking. The American Academy of Pediatrics, as well as a few other agencies, including Park Nicollet, actually, have some resources online about how to talk to your kids about things like school violence. I actually wrote a blog that several years ago, actually related to a previous school shooting, but still applies, with some information on how to talk to kids about when bad things happen and when violence happens. And so wanted to know everybody to know there are resources out there that you can easily connect with and find online that will help you frame those conversations. Okay, so now let's talk about a few ways that the foundation, Park Nicollet Foundation, and all of the foundations across our organization support our work and care for children. And, as I was putting together this particular slide, I thought, geez, I could have 18 bullet points on here, more than that, probably. But here were a few that came top of mind. Foundation funds have helped us run our school-based clinics. We have 4 school-based clinics that are run in conjunction with Park Nicollet Primary Care, and have been amazing resources for the kids in those high schools and school districts, really. And it's been a great partnership between school districts, communities, our Park Nicollet Foundation, and our Park Nicollet Care Group to offer those services. We have a really cool telehealth mental health access program where kids can basically access a computer in school during the school day and do therapy appointments if they need to, so that transportation doesn't become an issue, or kids don't have to actually physically leave school to have a mental health appointment, which then may cause them to fall further behind in schoolwork, et cetera, et cetera. So amazing program. We have a new pilot program where we've got a therapist that's right in our clinic with us. And I'm lucky that it is actually at my clinic, and my site is the pilot site, but instant resource for my families that might be in crisis to chat with a therapist pretty close to real time. If she's not available, we'll get them seen very quickly. And my patients have been loving it. And been an amazing resource, but would not probably have been possible if we didn't have some foundation support to get that program up and running until we can figure out other revenue bases long term to keep it going. They have helped us out recently with some equipment purchases to help with newborn jaundice management at home, funds to help with pediatric friendly environments in our clinic. So we see over 200,000 well childs a year. We need to make sure that we are, having little games and things for kids to play, and that it feels like a very welcoming environment. And some of the foundation grants have allowed us to do so. I think this is not specific to pediatrics, but our foundation teams do a wonderful job supporting funds and manpower to help combat burnout and in our clinics and in our hospitals. And obviously that has been a major issue in the world of healthcare that continues to happen. Our SIM Center has been wonderful, especially in the hospital, helping us scenarios with newborns and emergency care and things like that. And then I wanted to call out the support that the foundation has given us in terms of supporting our Teen Leadership Council across the system. Our Teen Leadership Council, if you're not familiar with that, is a group of approximately 20 high school students that sign up and apply to be part of this group. And it's kind of like an advisory committee that guides us on policy decisions related to kid care, but also those kids are learning about healthcare, their future, they're interested in potentially healthcare or social service work in the future. And so they get to build a whole bunch of skills related and get exposure to the field of medicine. So really amazing work, and I very much appreciate all of the support that Care for Children have received from our foundation. With that, I will let Abby and Pete guide us on any questions that anybody has.
Well, Dr. Singh, first of all, thank you so much for your excellent presentation. Just when you were presenting, I have to say, just like that passion you have for the work that you do is evident and very infectious. So thank you so much. We do have a couple questions here. Let me just loading on my end. First question is, do you find that parents are coming to visits with information or ideas from the internet, and how do you redirect misconceptions?
Sure. Of course they are. Like, where do we get our information, right? Sometimes it's your neighbor told you something. Sometimes it's I saw a TikTok. And so redirect by going back to evidence and really looking at data and our knowledge. I mean, there is a reason that I spent 7 years of specific training for medical school and residency, and then continue to, do my continuing education requirements and things to stay on top of things. So sometimes the conversations can be challenging in redirection. Sometimes people are open to listening, but what I always tell parents is that it is their decision on how to care for their children. But when you come to me as a medical expert, I'm going to give you the expertise that I have, both based on data and my experience, to help hopefully guide you in the right direction. In a lot of ways, it's no different than bringing your car into a mechanic. Right? If you are not car savvy, I am not, and you say something weird is there's making noise with my brakes, and the mechanic tells me like you need new brakes. I have various options. I can either say, sorry, I don't believe you because I saw on TikTok that like that noise means that there's, you know, I just need more brake fluid and drive away, taking the risk of driving away. I can get new brakes. I can get a second opinion, right? Like there's all the things that you have choices about.
That's a great analogy, and thank you so much for that. Let's see here. We have another question here. With increasing type 1 diabetes diagnoses occurring, what role is your department engaging in to screen for type 1 diabetes before a diagnosis of type 1 diabetes? Is there follow through to information on delaying type 1 diabetes?
Good question. So as I mentioned, we are very lucky in the HealthPartners Park Nicollet system to have a really robust pediatric endocrine department. So type 1, unfortunately, a lot of times will show up fairly acutely. You know, a child is presenting with symptoms. Now there is, you know, this more delayed type 1 presentation that is becoming, I think, more common. And we are absolutely kind of looking for things. Right now, there is no specific evidence-based guidance on screening for type 1, but the science is changing all the time. And I anticipate, yep. And so screening for those antibodies and things, it's not part of our standard care at this point in time. But once the guidelines from the AAP change, and that's kind of how we make our decisions about what we screen for, I'm sure we'll be getting there at some point in time.
And just out of curiosity too, earlier in your presentation, you were talking about how your conversation and the nature of it can change based off of and adapt towards like the child's age and stuff like that. What recommendations do you have as like for parents like to try and adapt that same kind of strategy with their kids when they're having crucial conversations? Like, is that one of those resources that you had mentioned with the Academy of Pediatrics, or just how can you effectively communicate with your child as they age or between different ages?
Yeah, I mean, like, right, there's no class you take before you become a parent. There probably should be, frankly, but I think that part of it is us using the resources that are out there. So using trusted sources of evidence-based data to kind of help you guide conversations. And the American Academy of Pediatrics is a really big one that you can trust, and that can help you. And there actually are, you know, like resource guides and discussion guides that come from the American Academy of Pediatrics on many of those things that are tailored to developmental specific ages. But again, using your clinician, your child's clinician to ask a question, how do I talk about this with them, is an appropriate question for sure.
Thank you so much, Dr. Singh, and I appreciate your time. And if there's any other questions that come in after this presentation, is it okay if I field them on to you?
100%.
Wonderful. Well, thank you again for your time, and thank you everybody for attending. And I hope everyone has a great day.
Yeah, thanks for being here, everybody. I appreciate it.
Thank you.